Okay. Good afternoon, dear partners, dear guests, dear friends, those who are in the room and those who are connected virtually. Welcome to the beautiful Natal. We are deeply grateful to the G20 presidency, Brazil, and the G20 members for this incredible opportunity to be here with the side event titled Tackling AMR Across Sectors, the Value of the Antimicrobial Resistance Multi-Partner Trust Fund. Antimicrobials are powerful medicines essential for treating infectious diseases in both human health sector and agri-food sector. However, their misuse, among others, is leading to the rise of antimicrobial resistance, AMR, with huge impact on humans, animals, plants, and linked to pollution and the environment. Today's meeting aims to explore how the AMR Multi-Partner Trust Fund, established by the Quadripartite, the Food and Agriculture Organization of the United Nations, UN Environment Programme, World Health Organization, and the World Organization for Animal Health, is supporting countries in advancing their AMR response through the One Health approach. We will hear today from a range of countries and also from a range of speakers. Thank you so very much, all of you, for coming and for connecting virtually. Additionally, we will gain insights from our resource partners on the importance of instruments and mechanisms as the AMR MPTF in driving progress through financing and investing in the AMR response. With that, I would like to introduce Dr. Montserrat Arroyo Curibrenia, Chair of the MPTF Steering Committee and Deputy Director General of the World Organization for Animal Health. We have a video message from her. Let's listen to it.
Esteemed colleagues, partners, and honored guests, good afternoon from Paris. While I regret that I cannot be with you in person today, I am truly pleased to address you in the beautiful city of Natal. I extend my heartfelt thanks to the G20 presidency and its members for giving us this valuable opportunity to discuss a matter of critical importance: the growing challenge of antimicrobial resistance and the need to scale up action with sustainable funding. When I was a young veterinary student, if someone had told me that one day I'd be discussing the greatest health development threat of our times, superbugs, I would haven't believed it. Yet, here we are, confronting a stark reality. Microorganisms are becoming resistant to our most vital medicines, antibiotics, and other antimicrobials. This is a global challenge that threatens not just human health, but also animal health, food safety, and food security. It's also linked to pollution and the environment. If we fail to act now, the consequences could be catastrophic. But the future isn't set in stone. There's still some time to change the course. We know that by practicing prudent use of antimicrobials, preventing the use by following good practices in human, animal, plant, and environmental sectors, we can reduce the risk of AMR from developing and spreading. Effective management of AMR requires a coordinated and accelerated One Health approach, one that emphasizes collaboration, communication, and coordination across sectors, disciplines, and levels of governance. This comprehensive strategy is crucial in our efforts to curb this growing threat. To address this, the Quadripartite, the Food and Agriculture Organizations of the United Nations, the United Nations Environment Programme, the World Health Organization, and the World Organization for Animal Health launched the AMR Multi-Partner Trust Fund in 2019. This fund has been recognized by the UN Secretary General as a key mechanism to support countries via the Quadripartite by providing consistent, coordinated, and technical and financial assistance to develop and implement the multi-sectoral national action plans on antimicrobial resistance in countries and contribute to the Global Action Plan on AMR. Since 2019, we have proudly supported 14 developing countries in deploying comprehensive activities to address AMR holistically through the One Health approach. This includes the establishment of national multi-sectoral coordination mechanisms, improving their capacity, strengthen their surveillance capacities, develop and implement national action plans, raise awareness of, and promote One Health advocacy on AMR. Moreover, 4 global programs of the fund focused on integrated surveillance, monitoring and evaluation, the environmental dimension of AMR, and legal aspects aim to further support and amplify country interventions. Thanks to the support of 5 key resource partners, the European Commission, Germany, the Netherlands, Sweden and the UK, we've already mobilized $30 million. In today's meeting, you'll learn more about the fund's catalytic role in helping countries efficiently prevent and respond to AMR, driving sustainable change at both the field and national levels. The need to maintain and increase sustainable investments to prevent, ensure surveillance, and effectively respond to AMR across sectors is widely recognized. Today, while 148 countries have national action plans in place, only 11% are funded, and if we aim to succeed in our collective efforts to address AMR, this number must reach 100%. The AMR MPTF is a crucial tool to ensure progress on this financial commitment, and it should hold a prominent place in the financial landscape of the global health architecture as a key financial mechanism to AMR response, working in synchrony with other funds, resource partners, and programs. I hope we can count on your critical support to expand the fund and its partners to rewrite a safer and healthier version of our common future, one in which we effectively preserve the antimicrobials essential to safeguarding human, animal, and plant health, while at the same time protecting the environment. I wish you a productive and interesting meeting. Thank you very much.
Actions through the One Health, implying coordination, collaboration, and communication and joint actions are crucial. And thank you, Dr. Montserrat, for highlighting this in the welcome video. So now I'm pleased to pass the floor to Dr. Niamasi. So he's the Director Interim of the Quadripartite Joint Secretariat. Dr. Niamasi, welcome for your welcome remarks.
Thank you, Nilea. Thank you, everyone. And I want to echo Nilea and Montserrat to thank Brazil for giving us this opportunity, but as well as the member states of the G20 for raising AMR at such high level. And as I said yesterday, it's not new because we've seen this being consistent in the G20 agenda since 2015 at least. We've seen always AMR being included in the discussion of the G20 leaders. And again, as I said, a One Health approach is the way to go. So AMR is a complex issue that's affecting more than one sector. And the solution as well involves to include all the sectors in the response. MPTF, I hope you are all now familiar with the acronym, has been a catalytic instrument, funding instrument, to forge this collaboration, not only globally by bringing together the 4 organizations, FAO, UNEP, WHO, and WUHA, to work together on some of the global program to address AMR in a One Health approach. But also, this catalytic fund has been instrumental to make the same collaboration happen in 14 countries. I will not speak about what was achieved because the countries themselves, they are here. They will just share with us the experience. But what I can say is that working together, the One Health approach response to AMR is feasible. It requires an effective coordination, it requires a sustained financing, and it requires a unified way of tracking the progress and meeting and coordinating all the efforts that we are putting in the response to the AMR. I want to echo again the chair of the steering committee to thank the resource partners. They have made it to happen. They have committed their money, but they have also stayed there in the discussion, in the technical discussion, through different meetings that we've had with them, trying as well to advise technically on how we can support the member states that are in need to implement a One Health response to AMR. I equally want to thank the countries that have received the funding, that have put at a better use, because that's helping us to document what is feasible and what is possible. I want to call upon to new other resource partners who are out there, but as well other member states and other organizations who are interested to come first and to learn on how the MPTF functions and how we deliver, but second and important, to join and support the fund to grow. The high-level meeting on AMR, which is happening in about 24 days now, it's critical. And MPTF has been recognized as one of the catalytic instruments to help us to deliver on a One Health response to AMR. We understand it's not the unique solution, because the solution mainly lies into countries themselves allocating their domestic resources to address AMR. However, we know, especially from the LMICs, that they can't do it alone. So there is a need for international collaboration and international financing mechanism. And MPTF is one of them. It's not the unique one. We need to call as well for the existing other financing mechanisms to continue to support the AMR response. Again, thank you for the people who have been able to join us today. We are glad to have you in the room, but we're also glad to have many online. And again, as we said, this is just really the beginning of the journey. So we hope that we're all going to go together and in a certain period, really celebrate that we have been able to reduce the burden that AMR is causing to our lives, economies, and livelihoods. Thank you.
Thank you so much, Jean-Pierre, for a very strong message. The key takeaway is working together is possible, but we need sustainable financing, we need coordinating our efforts, and we need to track our progress. And together we will succeed, and the MPTF embraces all these aspects. So with this, I would like to invite Mr. Anthony Darkovic, the AMR Survivor. So he's a member of the task force of AMR Survivors. Mr. Darkovic, the floor is yours for your story.
Thank you. Thank you very much.
Thank you.
Yeah, okay, great. Thank you very much for the invitation to be here today. Thank you to the AMR Multi-Partner Trust Fund, and thank you to Brazil for hosting. It's an honor to speak on behalf of patients and survivors of antimicrobial resistance. As a member of the WHO task force of AMR Survivors, I'm acutely aware of the impact of AMR and of the importance of the AMR Multi-Partner Trust Fund. I'd like to share a little bit of my own experience with AMR as a means to provide some context on why it's such a critical issue. In my case, a minor shoulder surgery was complicated by an infection that likely never would have happened without resistance, leading to more than 19 surgeries over more than a decade. My story starts with a very straightforward tear on my right shoulder, boring by all accounts, which, as I've learned, you want to be in the eyes of doctors as a patient. But the first surgery didn't resolve the pain and led to more complications, and subsequent surgeries didn't help either. As a standard, I was given antibiotics as prophylaxis to prevent infection before all of my surgeries. However, it took 7 surgeries before my doctors discovered that I had an infection, and once identified that that infection was resistant to the antibiotic they had been using as prophylaxis. So unknowingly, each of those 7 original surgeries was further spreading the infection. Once they identified it, I then had an additional 12 surgeries. First to clear the infection, and then to try to repair the nerve and joint damage that was as a result of that. And today I'm still recovering from this last surgery. I had a reverse total shoulder replacement and a series of muscle transfers to try to regain function in my right arm, my dominant arm. And so if I meet any of you afterwards, I'll fist bump you instead of shaking, because that's something I won't be able to do again. I think there's a perception that AMR is only an issue in the gravest of infections, but that is no doubt part of it. It makes severe infections more severe, but also, as my story highlights, allows infections to develop that otherwise wouldn't. The infection in my shoulder was caused by the same bacteria that's part of everyone's skin microbiome. Everyone in this room is probably colonized with it or has been colonized with it. It's the same bacteria that causes acne, in fact. But the reason it became such a severe issue, in my case, was because of resistance, because the antibiotics we used to prevent the development of infection in the first place no longer worked. And that had drastic clinical and personal implications. Said another way, in a world with more effective antimicrobials, this wouldn't have happened, and I wouldn't be speaking here today. I would have had routine surgery, and my life probably would have taken a very different course. But what is worse is that my story is not unique. It happens to millions of people around the world every year. And as a global society, we underinvest and underappreciate the foundational role antimicrobials play in our health systems, no matter what country. Antimicrobials serve as the bedrock of our health infrastructure, and for too long we've taken for granted that they'll work without question. My story and the stories of millions of others highlights that this is no longer a given. It is in this vein that the work of the AMR MTPF is so critical, to invest across all levels of the AMR value chain through a One Health approach to support country-specific implementation. I think it's also important to highlight that this is a big year for AMR, with the topic on the agenda here today, in the lead up to the G20, and also at the high-level meeting later this September in New York. It's critical that we leverage this attention to continue to drive progress. AMR is a perennial challenge, and we must ensure it remains on the global agenda moving forward. I want to emphasize that this shouldn't be a moment, it should be a movement, and it should continue. And while there's many people who don't see AMR in their daily lives, it's around all of us and affects all of us. It presents in the minor infections that become more severe, the severe infections that become even more dangerous, and like in my case, the infections that should have been prevented but weren't. AMR may be invisible, but the people who live with it and its consequences are not. I look forward to the discussions today on how we can accelerate momentum and continue to build on the successes of the AMR MPTF. Myself and the other members of the task force thank you for all your efforts and are willing to help in whatever way possible to make it a success. Thank you very much.
Thank you so much, Anthony, for an open eye on the need to work together, why actually we are working together to prevent and mitigate AMR. And indeed, I take note of the important message that antimicrobials are the bedrock of our systems, and we have to protect them so they can protect us, our animals, our plants, our ecosystems. So let me move now to our first session of the event. We will explore in this session the impact of AMR on the ground. So we have a couple of countries with us, those who have received the MPTF support. And I'm pleased to give the floor to Dr. Tepeng Tai, Deputy Director, Department of Animal Health and Veterinary Public Health, General Director of Animal Health and Production, Ministry of Agriculture, Forestry and Fisheries of Cambodia. So we have Dr. Beng Tai with us online. I hope that we can see him. Okay. Dr. Beng Tai, you are with us. Thank you for joining us.
Good afternoon.
Yeah. Can you hear us well?
Okay, yes.
Excellent. Thank you for coming. So we have a question to you. We aim to explore how the AMR MPTF has supported efforts to address AMR in Cambodia. How was the One Health approach applied in these efforts? We definitely would value some concrete examples, bringing us knowledge about the concrete changes the fund had at your country level, and what innovative aspects of the fund have helped achieve the One Health objectives. The floor is yours for your intervention.
Thank you very much, Nela. Good afternoon, ladies and gentlemen. My name is Beng Tai from Cambodia. I'm so glad to show you about the antimicrobial resistance activity has been implemented in Cambodia from the single to the multi-sector as a One Health approach. Next slide, please. Slides show you about the history of the AMR activity that has been implemented in Cambodia. Before 2016, only Ministry of Health apply and implement the AMR activity in the country. And then after 2016, Ministry of Health has engaged MAP to join with there as a technical working group in the MOH. And then in the 2017, Ministry of Agriculture, Forestry and Fishery established the technical working group, AMR technical working group, and then joined actively with the technical working group of the MOH. This technical working group has developed their own national action plan to combat AMR in the agricultural sector. And then the technical working group from MAP actively joined with the technical working group from the MOH. The activities still implemented their own sector. In the 2018, as the start One Health activity between the Ministry of Health and Ministry of Agriculture, the government has committed to multi-sectoral activity to combat AMR. And that's time the draft of multi-sectoral activity to combat AMR has been considered and developed a draft. In 2019, this multi-sectoral action plan to combat AMR has been developed and endorsed. And that's time there are the high-level Organization for Animal Health, FAO, and WHO to join the high-level meeting in Cambodia. After that, the sectoral action plan has been endorsed by three ministries: Ministry of Health, Ministry of Agriculture, Forestry and Fishery, and Ministry of Environment. In 2020, we have Cambodia endorse the multi-sectoral action plan and the support from the MPTF project, so that Cambodia has applied the such activity of the multi-sectoral action plan and then apply in the Cambodia. And until now. Next slide, please. Here is the slide show you about the high-level tripartite meeting in the 2017, and the book is the white one is AMR situation analysis in Cambodia, and the blue one is multi-sectoral action plan on AMR. And the next picture is the ceremony of the high level for signing the multi-sectoral action plan from the three ministries. And then the high level of the ministry as the Secretary of State. Next slide, please. How the AMR MPTF support the Cambodia effort to address the AMR and drive and successful progress in National Action Plan implementation in Cambodia. Under the support of the MPTF, MPTF activity link several strategic action plan from the multi-sectoral action plan that has been developed and endorsed. So that there are three main strategic objectives that has been supported by MPTS. These three is shown in the slide. I have not much time to tell you because it's a limit time. And then the impact of the MPTF project is very important. And there are the two main points that mean the impact of these projects. The first one, Cambodia make a explicit commitment, policy mechanism, investment plan, program, legal framework, resource allocated to combat AMR. The second one is antimicrobial use associated with the behavior and practice sustainability improve in critical sector, especially from the Ministry of Health and Ministry of Agriculture, Forestry and Fishery. Next slide, please. Next. Here is the example of the governance and mechanism that has been established under the MPTF program. The multi-sectoral technical working group for the AMR has been established. It derived from that technical working group to combat AMR, the Royal Government of Cambodia established the One Health National Interministerial Committee. This committee is composed from Ministry of Health, Ministry of Agriculture, Forestry and Fishery, and Ministry of Environment. The chair of this committee is the Secretary of the Ministry of Health, and the two secretaries from other ministry are the vice chair. From the committee, the multi-sectoral action plan that has been developed with the mandate from 2019 to 2023 has been revised. And now this revised action plan has been finalized and will be endorsed soonly. Next slide, please. This is an example of the legal framework or the guideline or SOP or standard has been developed. This SOP and standard will be used to capacity building of the end user on how to produce with the responsible. This guideline and SOP has been printed and supported by another project as well. And the important that the government has the team, has the staff that can be continuous by using this material to capacity building of the end user and the ground level. The important thing, this project has been developed, the communication strategy and the IEC material for aware and capacity building to the public as well. This material has been developed and printed also and distributed to all stakeholders. Next slide, please. The development partner that support to the Cambodia to implement AMR activity in Cambodia. The first one, we have the support from the Fleming Fund, from the UK, USAID. We have the program. We have the Korean agency who develop for the food safety. And then the last one, we have the German Development Bank as a KWS support the implementation AMR activity forward. And then we have the government budget allocated, so that the government budget allocated is start from the beginning until now. And then the staff and the level of the interministerial committee is from the government officer. Next slide, please. I think that my slide is finished. Okay, thank you.
Thank you so much, Dr. Bentai, for your presentation and for outlining the progress that has been achieved in Cambodia thanks to the MPTF. We note that the MPTF support led to a strong political commitment and engagement at country level, that it led to the development of investment plan and allocation of domestic resources, and also the improvement in critical areas of AMR interventions. So let me move to the next speakers, and we really would like to ask our speakers to stick to the allocated timing so we ensure that we can have all the interventions and discussions in this session. I would like now to invite Dr. Yanti Herman, Director of Quality Health Services at the Ministry of Health of Indonesia, to speak. Dr. Yanti, I hope you are with us.
Yeah.
Just a
Thank
second. We should skip this one. Yes. So thank you so much for being with us today. We have the same question to you. How has the MPTF supported your efforts in Indonesia? How was the One Health approach applied in this context? We would value any specific examples of concrete changes that fund has brought at country level, and also what innovative aspects of the fund have contributed to achieving the One Health objectives. The floor is yours. Please keep it to 4 minutes. Thank you.
Okay, thank you. Good afternoon for Natal, Brazil. And it is currently 1:30 a.m. here in Indonesia. Okay. Today, I will discuss Indonesian effort to combat antimicrobial resistance through the multi-sector AMR control program, which is supported by the Multi-Partner Trust Fund, MPTF. I will also address the geographical challenge we face and the support required to effectively tackle AMR. The MPTF project has been pivotal in our effort to combat AMR. It has facilitated cooperation among key ministries, including agriculture, health, human development and culture, marine affairs and fisheries, the Food and Drug Monitoring Agency, and environment and forestry. The project employs One Health approach, integrating effort across human, animal, and environmental health. We have achieved enhanced cross-sector coordination, particularly in antimicrobial stewardship, EMS, and infection prevention and control, IPC-WOS. There are 3 main activities that have been implemented with MPTF support for Indonesia, which are: number 1, improve knowledge and practice, which include joint assessment, have advanced EMS and IPC-WOS practices. This include conducting assessment in hospital, training 18 staff, and assessing 80 farmers with biosecurity and prudent antibiotic use. Number 2, enhance distribution chains by strengthen antimicrobial distribution through the introduction of new joint inspection guidelines. Number 3, increase multi-sector engagement, which include broad involvement, including collaboration with journalists and private companies. For the 3 sectors mentioned above, there are 3 innovative, next slide. There are 3 innovative aspects of MPTF funding support that have contributed to achieving sustainable One Health outcomes in Indonesia. Number 1, best practice adaptation, including development of AMS and IPC-WOS assess tools, the integrating both international and national guidelines. Number 2, targeted awareness, including engaging of stakeholder like the Dependent Journalist Association to boost AMR awareness. Number 3, private sector involvement, including increased involvement of key private sector actors, which ensuring long-term sustainability. As the world's largest archipelagic country with over 17,000 islands, Indonesia faces significant challenges in accessing healthcare, particularly in remote and eastern region. Many areas continue to struggle with inadequate services. To address this, we have developed a national AMR control strategy for the next 5 years based on the WHO People-Centered Approach guidelines. To enhance our AMR effort, we need support in 4 main areas, of which are we need, number 1, strengthening human resources, which include boosting capacity among healthcare professionals and microbiology laboratories. Number 2, improving infrastructure and logistics by addressing disparities in healthcare capabilities. And number 3, national expert support, which includes assistance with developing AMR policies. And number 4, strengthening information system, which include enhancing system to better track and respond to AMR trends. Of course, MPTF support has been crucial in advancing Indonesian AMR control through the comprehensive One Health approach by improving knowledge and practices, enhancing distribution chains, and increase multi-sector engagement. Addressing our unique geographical challenges requires ongoing support and collaboration. We remain committed to this effort and appreciate your attention. Thank you.
Thank you so much, Dr. Herman, for your commitment, but also for very important messages that you have shared together with us from Indonesia. So we definitely note the innovative aspects of the MPTF, which is the adaptation of best practices, the targeted awareness strategies, and the private sector engagement, proving that we cannot tackle AMR alone. We need all of society approach to ensure that we make progress. So let's move now from that continent to another one. So we have a representative of Peru today with us, Dr. Roni Gavidan Chavez. So you are Technical Secretary of the Multi-Sectoral Commission on Antimicrobial Resistance of Peru. Thank you so much for coming. So Dr. Chavez, we are eager to learn from your experience in Peru. So how has the MPTF supported efforts at your country level to tackle AMR? How was the One Health approach applied in this context? What concrete examples of changes you can bring to us, and what innovative aspects also you could highlight? The floor is yours.
Okay, thank you for this invitation, and thanks for, thank you for give this opportunity to highlight some aspects of the progress in containing antimicrobial resistance in Peru. Well, first I need to highlight the committee, a national committee to friend against the antimicrobial resistance in Peru. That is very important for us in Peru. That was approved in 2019, where when included different ministries. Actually, we have 11 ministries and different institutions from academy and universities and research, including other actors. And also, I need to highlight that projects of cooperation like MPTF and other projects help to the countries to like a seed budget in order to improve the activities and validate all the activities that performed in mark of the national action plans. You know that previous colleagues said that probably most of the countries around the world have no specific budget for antimicrobial resistance. This kind of projects, cooperation projects, give us the opportunity to establish some initiatives in our countries and activities related to the national action plan. Also, this is a slide in order to show the different aspects and activities that we perform in Peru based on the MPTF project. Only let me to highlight that the line of base is very important in order to identify the gaps that we have to implement in our countries. And let me to highlight, for example, the surveillance. We said that it's very important to continue in the under One Health approach, but please continue reinforcing the hospitalary surveillance, the human sector surveillance, because this is probably our target, no, in terms of multi-drug pathogens and emergency. In particular, this year, for example, we generate this epidemiological alert in the Klebsiella pneumoniae that is a multi-drug resistant carbapenemase producing, and also is more or is higher virulence than another variant of this Klebsiella. No, this is very important, not only in Peru, but the another aspect that is very important in Peru is the surveillance of antimicrobial resistance under the One Health approach. And we here identified three sectors, three producer change, and including Salmonella and E. coli as a bacteria to show the surveillance. It was difficult to work in multi-sectoral approaches, but we are working in different pathogens. Salmonella, for example, is a very interesting pathogen as an emerging multi-drug resistance that are associated not with a hospitallary pathogen, but it's a communitary in another sector also. We have some documents, like a manual for procedures for microbiology, specifically focusing on antimicrobial resistance. We have a protocol and document specific for the surveillance under the One Health approach. Recently, based on the MPTF Health, we are close to approve the law for the contention of antimicrobial resistance in Peru. Actually, this is in the Congress of Peru that we are in the last step of approbation. Probably if all the planets aligned, probably this year will we approve this law. And also we have a new version of the National Action Plan, including, for example, very important aspect like environment, for example, that we must include in our national action plans. We have different gaps and problems, but probably the future is really enthusiastic. And probably the last aspect that we are working instead the politics for the government is very important to promote the sustainability in terms of economy and the budget, specific for antimicrobial resistance, and policy for normatives and another documents that allow to the countries continue with these activities and a long time. No? And please let me thank my equipment in the National Action Plan Committee. That's all for me. Thank you.
Dr. Chavez, thank you so very much for sharing the experience from Peru. Obviously, we know a lot of challenges exist in multi-sectoral collaboration and in addressing AMR, including the one that countries not always have funding, dedicated funding to support the activities, and this is a permanent challenge that we have to address. But the MPTF mechanism, as the MPTF, they have this catalytic power to actually support countries in these activities, and also bring some innovative aspects as the progress in legislation, progress in environmental aspects. So thanks to this program, to this mechanism, we can support countries in innovating. So let's move from Latin America to Africa, and we have today with us Dr. Mashe. So Dr. Mashe, I would like to ask you the same questions. You are coming from Zimbabwe, you are the AMR coordinator. The same question to you, how the AMR MPTF was helpful in your country, in Zimbabwe? How was the One Health approach addressed in this context? What specific examples you have to share today with us, and if you could highlight also some innovative approaches. Thank you so much. The floor is yours.
Okay, thank you so much for allowing time for Zimbabwe to share what we have done. I think you have told that MPTF is a catalytic fund which helps to implement a few activities. So we've managed to select a few catalytic activities using the resources that were available. So I'm going to share with you what we have done and what we have achieved with the catalytic fund that we got from MPTF. So the title of my presentation is Partnership for Progress. So I'll share with you. So I have managed to just break down what we have done in 4 areas. So the first one is vaccines offers hope. We are going to talk about what we have done under that section. We're also going to talk about raising the bar, which is going to focus on farmer food school that we have implemented, and also improving patient safety and infection control. So what we have done under the vaccines offered hope, as a country, we managed to select one activity that has helped us so much to improve awareness on AMR, also to improve the livelihood of the general public of Zimbabwe. What we have done, we have managed to produce a vaccine. As you know, one of the strategies to reduce antimicrobial resistance is to look for alternatives. So we have introduced a vaccine for animal health, which is a theileriosis vaccine, which is a vaccine that manages theileriosis disease, which is also called January disease. As you know that when these animals are infected by this, they are also given some antibiotics. So as a way of reducing use of antimicrobials in the animal food, we have introduced this vaccine. So this was one of our intervention activity that we have done to introduce a vaccine. As for now, we have managed to produce around 250,000 doses of vaccines. And this was not just an activity to reduce the impact on AMR, but also to improve the economy of the country. One of the areas of economy that we are strong at in Zimbabwe is cattle ranching. So we had suffered a loss of more than 500,000 cattle, and introducing this vaccine was also helping in terms of economic value. So far we have distributed these vaccines to different provinces and also have some of the vaccines in stock. Another area that we also implemented under this vaccine offers hope was also a measure of or intervention. We measured the intervention that we did. As a country, we had been recording a lot of typhoid cases. So because of these typhoid cases, one of the measures that we implemented was introducing what we call typhoid conjugate vaccine, TCV, to the age group between 6 months and 15 years. So under the MPTF grant, what we also did was to measure how effective was this intervention of introducing a TCV vaccine. So as you can see from this figure that I'm showing you, there is a reduction in incidence of typhoid in Zimbabwe. And we have also measured the indirect effect, because we only gave the 6 months to 15 years old the vaccine, but we also recorded herd immunity. I didn't show this slide because of time, but I had 3 or more slides which speaks to this intervention. And this was one of the activities that we have done. Under the raising the banner or raising the bar, what we have done also was to introduce what we call farmer food school. The ultimate goal was also to reduce the use of antimicrobials. So the idea was to teach farmers on how to produce chickens without antibiotics. So we're teaching them how to do it in a way that is sustainable. So we have managed to recruit about 900 farmers, and we have about 30 schools that are operating in different provinces in Zimbabwe. So the objective of this intervention was to educate farmers on best practices in broiler production to minimize antimicrobial use. It has worked miracles. We now have farmers that can produce chickens without use of antimicrobials, and it also have benefited them economically, apart from it being a scientific intervention which is reducing the impact of antimicrobial resistance, but only economic-wise it has helped the farmers to reap from their efforts. Another intervention that we also introduced, or that we also participated in using the MPTF fund, was the improving patient safety. On this one, what we did, we managed to produce or managed to develop 3 or 2 guidelines, one which is the infection control policy. This covers what to do in terms of infection control. Then under that bigger policy, we also introduced our national IPC strategy, which spans from 2024, which is this year, to 2026. And one of the activities that we included in this strategic plan was to measure the impact of hospital-acquired infection. So it was also one of the intervention, or one of the activities that we also included under the MPTF grant to measure hospital-associated infection or hospital or healthcare associated infection. So under this project, which is still ongoing, we are still sampling, but this is more of an observational study. We are not implementing any interventions, but we started as a pilot project. We want to see the burden of these HIs in different hospitals. So we've selected 2 central hospitals in Zimbabwe, which are the biggest 2 hospitals. We started sampling and just to observe what is happening within those hospitals in May, and we are still sampling. As for now, we have managed to identify about 1,800 hospital-acquired infections, and we are focusing on 3 areas. As we are starting as a pilot, we just want to check what is happening. We are focusing on late neonatal sepsis. We are also focusing on surgical site infections and catheter urinary tract infections. So far, we have recorded about 23 deaths due to these hospital-acquired infections. So we are going to continue with this activity until December, because we've given ourselves 3 months just to observe what is happening within these hospitals. With this, I thank you. We just selected a few to showcase because of time. Thank you so much.
Thank you so much, Dr. Tapfumane Mashe, for sharing the experience of Zimbabwe. Obviously, we note so many progress activities that have been implemented in your country thanks to the MPTF. We know specifically the accent on vaccination, on preventive strategies, and also on behavior change through the farmer field schools and the ground activities, communities activities that really have been possible thanks to the MPTF. So thank you for sharing this experience with us. We are very cognizant of time, so we would need to move to our next panel. And in the next panel, we would like to shift a bit the accents, as we have heard the country's experience in implementing the MPTF. But we would love also to hear the perspectives of our resource partners. Why have they decided to support the MPTF? So today we have 2 resource partners with us connecting virtually. So we have Dr. Nicola Watt, Component Lead, International Cooperation, Global Program, Pandemic Prevention and Response, One Health, GIZ from Germany. Welcome. And we have also Ms. Holly Reiner-Jones, Head of the Fleming Fund from the United Kingdom. We are very grateful for your presence today with us. So we would like to know why you choose to invest in the MPTF, and why you believe that further expanding support to the fund is crucial for an effective response at both country and global levels. What would you say to other resource partners to encourage them to invest in the fund? Dr. Watt, let's start with your intervention. Thank you.
Thanks very much. Do you hear me okay?
Yes.
Super. So good morning, good afternoon, and good evening. I think we've got all time zones represented here. I'm really grateful for this opportunity to talk to you at this very important event. As you've said, I'm Nicola Watt. I'm part of the GIZ Global Programme now for Pandemic Resilience, since yesterday, Pandemic Resilience One Health, which is implemented by the GIZ on behalf of the Federal Ministry for Economic and Cooperation and Development in Germany. And since 2021, we've had an unearmarked financial contribution to the MPTF. And in addition to that, it's been our pleasure to support technically through the steering committee. So BMZ and we take part in the steering committee. And we've also supported behind the scenes technically, for example, following the midterm review. We do also have other contributions to AMR. We've supported the Secretariat, the Quadripartite Joint Secretariat, and we've been supporting the new multi-partner, the partnership platform, the AMR partnership platform, which we believe has got a very important role in making the discourse on AMR much more diverse and inclusive. So I'm going to highlight two aspects of the MPTF in response to the question. The first is the collaboration across the quadripartite, because this multi-sectorality is so important and needs to be strengthened, including the environmental dimension. And then the implementation at national level, which we've just heard some great examples about how diverse that can look according to the context. And really, we need countries to be in the lead if we're to make any progress. And it's important that MPTF, as we've heard already, makes bridges to other initiatives. And so actually behind the scenes in Cambodia, our program was also involved in the recent review of the multi-sectoral action plan on AMR. And those kinds of collaborations over the borders of the MPTF are what helps make it more sustainable. And that's what convinces me that we need much more support for the MPTF and its aims. It might not always be financial. It can also be technical, as I say. And this continued support is so important because the implementation of national action plans requires ongoing investment, capacity development and review. And for resilience, that has to come from a broad range of sources and not just a small number of sources. Increasingly, it should also include support for domestic investment. And we know, however, that that's not yet sufficient. We know that there are lots of challenges. There are many demands on financing and an awful lot of different financing mechanisms to choose between. And so that's why clarity of purpose and good coordination internally and with other partners is so important. So really welcome the processes that the MPTF has been going through, really welcome this dialogue, particularly in the run-up to the high-level meeting, and particularly in this context, because I do believe that the G20 holds such energy and momentum that could really inject some new energy into this, this debate and help diversify the funding base for the MPTF. So thank you to the organisers and look forward to the further discussion. Thanks.
Thank you so much, Dr. Watt, for your intervention. And thank you so much for your precious support. You have highlighted very important points, the need for collaboration across the quadripartite and across the different sectors, and also the capacity of MPTF in building bridges with other initiatives at country level, and also the potential to catalyze not only financing support, but also resources, skills, knowledge. So thank you so much for supporting the MPTF. I would like also to turn to Dr. Rainer Jones. So you are the head of Fleming Fund from the UK. So the same question to you. Why did the UK choose to invest in the MPTF, and why do you believe that further expanding the support to fund is essential for an effective AMR response? And what message would you convey to other resource partners in order to encourage them to invest in the fund? Ms. Reiner-Jones, the floor is yours.
Good afternoon, everyone. I'm just checking you can hear me clearly.
We can hear you, yes.
Great, thank you, and thank you for inviting me to speak today. The two parts of this question, well, the initial part of the question, why we've chosen to invest in the AMR MPTF and how this aligns with our strategic priorities for global health funding are really inextricably linked in my view. The Fleming Fund, which is part of the UK Department of Health and Social Care and uses UK government aid funding, has decided to invest in the AMR MPTF for the very reason that we see tackling AMR as a strategic priority for global health. So AMR is an insidious and cripplingly inequitable pandemic, but it doesn't make the headlines in the same way that COVID-19 does. Yet millions of lives are claimed every year. AMR is deeply painful and a deeply painful and personal crisis, as was highlighted by Anthony from the AMR Task Force for Survivors in his opening remarks. It's also a global emergency facing hospitals and community health centres, farms, and it's seeping into the environment around us. It's, ever present, really. So for this reason, the UK government, through the Fleming Fund and through our sister programme, the Global AMR Innovation Fund, also known as GAMRIF, have been set up respectively to strengthen surveillance systems and use data to tackle the deadly impact of AMR, and to develop innovative products, including therapeutics, preventatives, and diagnostics to prevent the impact of AMR through a One Health approach. The Fleming Fund is the world's largest official development assistance programme, supporting low and middle income countries in Africa and Asia to strengthen their surveillance systems, to generate, share, and use AMR data to reduce the deadly impact of drug resistance. And it was great to hear from representatives from Cambodia, Indonesia, and Zimbabwe, where the Fleming Fund partners alongside 23 other countries in these regions. At the Fleming Fund's core is the principle of country ownership, with any Fleming Fund surveillance activities being driven by surveillance pillars of a country's national action plan for AMR and the priorities set by national governments. The Fleming Fund was designed with this approach at the forefront, and the intention was always that following the development of NAPS, the fund would be positioned to support the implementation of surveillance priorities set out in these plans. Our experience of delivering the Fleming Fund over the past 7+ years has really been that it's not as simple as kind of swooping in to support the implementation of surveillance priorities defined in NAPS. Without strong governance structures in place, NAPS are meaningless, and defining priorities is really impossible. The presence of functioning AMR coordinating committees, technical working groups, and coordination across ministries representing One Health sectors, as described by some of the other presenters speaking today, is really vital. The Fleming Fund has supported this in a piecemeal way, partly through country grants and partly through our direct grants with FAO, WHO, WOA, and others. And that's provided broad NAP support at the global level and targeted support to some countries. However, it's been evident that a more comprehensive approach to supporting countries to strengthen AMR governance and implement NAP priorities was really needed. And this was the driving force behind our initial contribution to the AMR MPTF, which we felt as an AMR fund led by the Quadripartite was ideally positioned to provide coordinated support to strengthen AMR governance and the implementation of NAP priorities. We've chosen to provide substantial and ongoing investment to the AMR MPTF because not only is the MPTF well placed to provide this essential support to strengthen AMR governance in countries, but the fund offers the opportunity to coordinate donors and AMR activity at the country, regional, and global level. The MPTF has the opportunity to ensure that duplication of funding and activity is avoided, and crucially, that implementation is driven by the needs and priorities of countries rather than funders. We've seen value in the MPTF work delivered at the country level and also the work of the global projects, and it's for these reasons that we've continued to invest in this fund. I'm going to just move on to the second part of the question now, and I'll try and be quick because I know we're short of time. But in terms of why we invest in AMR, the list of reasons for investing in this area is long and should be well known by many in this audience. But as a brief reminder, 1.27 million attributable and up to 5 million associated deaths annually are linked to AMR, with these deaths disproportionately burdening low and middle income countries. Treating resistant infections is projected to cost $412 billion US, and economic productivity losses are expected to be about 443 billion. AMR is projected to cause an 11% decline in livestock production in low and middle income countries by 2050, all of which, as we know, will jeopardize the achievement of the Sustainable Development Goals. So hopefully we're all convinced of the need to invest in AMR, but why invest in this fund? If donors are convinced of the case to support AMR, then funding through the AMR MPTF is the right way to do it for a whole plethora of reasons. But given limited time today, I'll just focus on 3 of these. Speaking to my earlier points, the AMR MPTF, led by the Quadripartite, is well placed to provide the crucial support needed to strengthening national and global AMR governance, which is a prerequisite to developing and implementing One Health national action plans and actually tackling AMR. Secondly, coordination of donor funding. So the AMR MPTF is positioned to ensure we avoid duplication of funding and activities and secure value for money. Crucially, the MPTF provides a mechanism for ensuring that AMR interventions are driven by the priorities of countries being supported rather than the whims of donors, and saying this as representing a donor. Finally, AMR is a global problem that affects the world's population, and it should be tackled globally. So far, the MPTF has been funded by a small group of European countries. This is a global fund which should support LMICs, but which should be funded by countries and donors from around the world. If we are to address the deadly impact of AMR and fight drug resistance, then a coherent, coordinated global approach combined with a tailored approach adapted to specific country needs is required. And the AMR MPTF is the platform through which this can be done. Thank you very much.
Thank you so much, Ms. Reiner-Jones, for your intervention and for believing and seeing the value in the MPTF. Thank you both for your presentations and for your votes today. It's thanks actually to our generous support of our current resource partners, Germany, the UK, the Netherlands, the European Commission, Sweden, who have supported the funds since the beginning, and thanks to whom actually we have managed to see progress in so many countries across the world. And we hope that many more will come, more funding will come and more support will come, and we will be able to reach more countries. So let me maybe move to our questions and answer session. We unfortunately are very limited in time. So we have some questions in the chat box, and also if there are any questions in the room, you're more than welcome to step in. Don't be shy. If you have any questions to our panelists, please feel free. Yes, I think we have one, or comments or observations or ideas.
Thank you. This is Fabrizio from UNEP, and my question is, like, knowing that the MPTF is supporting LMICs, how do you think the MPTF is strengthening the collaboration between sectors at the national level, and which further steps could be taken at the country level to further strengthen and enhance this collaboration?
So I don't know who wants from our panelists to take this question. Dr. Mashe, please.
Thank you so much for your question, which talks about how MPTF is promoting collaboration between ministries or collaboration between organizations. I think the first thing that you need to know about MPTF is that already the delivering partners or the partners that are working in the MPTF quadripartite, there's already that working together from that start. Well, the grant is not supporting one organization, is supporting all the organizations, and these organizations are coming from different sectors altogether. And most of the activity that are implemented at a country level, I think if you followed how, or what I've been presenting, there are animal health activity, there are human health activities. So it's a combination of different activities that are being implemented by different countries, because each organization will have an activity that is going to implement. So that's already, that setup promotes working together, because we always meet all the time to discuss progress. You discuss about farmer food school, you discuss about hospital-acquired infection, you discuss about typhoid. You know, this is a human health which is managed maybe by WHO or Ministry of Health. But the guys from FAO or the guys from Ministry of Agriculture, they will know about it, because all these activities are being implemented by 3 partners.
Thank you so much. Yeah, you want to compliment, please?
Thanks. It's a good question. Actually, MPTF also, I think that the pillar of MPTF help is the governance, in particular in the country. In Peru, the governance in terms of antimicrobial resistance is part of the National Committee for Antimicrobial Resistance. This is very important to the MPTF work directly and coordinated with this committee, the National Action Plan in Peru. That's probably give us the sustainability in order to incorporate new initiatives in the mark of the multi-sectorial approaches. That is very difficult. It's complicated in our countries in general, in Latin America. The multi-sectorial work is complicated. It's difficult to work. I always say that it's difficult to work on different bosses. My boss is the Minister of Health. There are bosses in agriculture and other different ministers. It's complicated, but with this kind of project, help us to reinforce the governance in the country.
Thank you so much, Dr. Chavez, for sharing the insights. Indeed, that's a very important and good question. And I think we have also a similar one in our chat box. So we have greetings from Madagascar, a question for Dr. Mashe. How did the AMR MPTF project support the establishment of a functional AMR Secretariat to support effective multi-sectoral work in your country within the One Health approach? So if you want to address this one.
Okay, thank you so much for your question. I think I've already shared some of the aspects of it to say, because MPTF project or MPTF grant was coming from the tripartite, which is now the quadripartite point of view. So because of that already, it forced us to work together from different ministries. And it was also a good platform to strengthen the One Health Secretariat, which is now currently functional. And one of the strengths about our AMR activities in Zimbabwe, because we are working from a One Health approach, we don't have any problems. I can hear my colleague here to say there's challenge maybe moving from one ministry to another. But one thing that we have managed to strengthen is access to every ministry. That makes our programs move so well without any challenges. We can easily go to the Minister of Agriculture, Minister of Environment, Minister of Health, and some of the people leading these interventions are also coming from these ministries. So I can say this project helped us to strengthen the One Health approach, which gave birth to what we now call One Health Secretariat in Zimbabwe, which we now have represented from different ministries working together on a full-time basis in one office.
Thank you so much, Dr. Mashe. Any other questions in the room? Yeah, please.
Thank you very much for the insightful presentations. I have 2 questions. The first one, we heard how critical this trust fund is to help us to mitigate the impact of AMR. I would like to ask what efforts we are doing to leverage these mechanisms to ensure that we have sustainable funding for AMR. And what about the domestic financing? Do we have examples from the countries that had the fund from the Multi-Partner Trust Fund that in turn had also some domestic funding raised? And the second question, it's about the patients and the AMR Survivor. Do we have examples from countries embracing this initiative that WHO has established? Thank you.
Thank you so much. Very good questions indeed on sustainability, leverage, catalyzing domestic financing, and also Survivor. So I don't know if our speakers want to answer. Yeah.
Okay, maybe I can start. That's a very interesting question about sustainability. I think when I submitted my activities, I talked about catalytic activities. So what we did when we were given this opportunity to apply for this Fleming Fund grant, we looked for high impact activities that were going to generate interest in the political sphere. So Zimbabwe economy is based in two issues, or based on two fundamentals: mining and agriculture. So if you want to interest the politician, talk about agriculture. As I said that, the general disease, it has managed to kill more than 500,000 cattle, which includes cattle of politicians. So it was very easy now to say we want to introduce this vaccine, which is also going to improve the economy and also improve the livelihood of the people, because majority of people survive on agriculture, and cattle is one of the income which the low income people use as a base. So because of that, now we now have this goodwill from the politicians, and we are now in the budget period where we are now promoting or campaigning to add some components of activity that we want now to add it in the budget framework of the country as a whole. Because of these activities, which were very high impact, which were closer to their heart, it's now easy for us to just go and say we now want a budget line that supports AMR, because we also need domestic funding. All these funding organisms, or all these funding mechanisms are just meant to help us to move from one step to another.
And then I can address your second question quite quickly. I know we're coming up on time, but myself, as I mentioned, I'm representative of the WHO Task Force of AMR Survivors. There's 12 of us on the task force that come from across a variety of countries, including some countries that are covered by the Multi-Partner Trust Fund. I think your question is on point, in that more awareness is needed around patients who've experienced this to really contextualize what it looks like in the countries where we're trying to catalyze that impact. And so I would encourage other patients who've experienced this to speak up and share their voice, because I think it provides a compelling context of the reason why there needs to be so much effort behind addressing AMR.
Thank you so much. I don't know if our speakers who are connected virtually, if they want to also elaborate on these questions. I don't know if we can see them maybe on the screen.
So I have some experience also on the sustainable of the activity to combat the AMR as well. As our government high commitment to continuous MPTF activity toward.
We are trying to put the image of our speakers on the big screen. Just a second. Okay, you can go ahead. In the meantime, we try to figure out the video.
As from the Cambodia side, I think that the sustainable of activity to combat the AMR is important from the commitment of the high policymaker first, and then the use of the existing mechanism from the Ministry of Agriculture, Ministry of Health, and Ministry of Environment. All officers are joining in the technical activity from the national level until the subnational level, so that the collaboration multi-sectoral is the vertical and horizontal. So that the vertical, each ministry that has a mechanism, that has an organigram from the national level until the community. So that when the national level start to collaborate together at the horizontal line, so that at the subnational level also they can collaborate with those levels as well. The important thing that the the government allocate the staff and allocate the budget also by raising another fund from the development partner. So that now our One Health Interministerial Committee has engaged with the German Development Bank as a grant to support the AMR activity in Cambodia start from now, after the MPTF. Over from my side.
Dr. Bengtai, thank you so much for sharing this experience. Indeed, very useful. I'm very cognizant of time, and still we have some questions in the chat box. I don't know if we can run maybe 1 minute extra time and be very short. So one of the questions is on the role of students and actually how students, as the new generation, they can engage in the fund and support the activities within. And the second question is how we engage with the industries and the private sector. So if very shortly, please, speakers from connected virtually or those sitting here, just let us know who wants to take the floor.
Okay, thank you. That's very important. I think so. The education is a good strategy for the long period, in particular in children and in professional of health. At a short place, probably the children, professional health, and a long time, probably the children. That is why in Peru we incorporate in the Ministry of Education as a part of this multi-sectoral committee for antimicrobial resistance.
Thank you.
Thank you so much. Maybe in short, one of the activities that we have also implemented in Zimbabwe through the Fleming Fund, not the MPTF, was to add an AMR module in the nursing curriculum. So the current group of nurses that has been enrolled this year, they now have an AMR as one of their module. And we're also implementing activities where we are bringing in secondary and primary school kids so that they understand the basic interventions like washing of hands. So we are also starting from that level where we're now engaging with these students so that it also helps in terms of sustainability, because you can't keep having workshops to study AMR. It's easy if it's implemented in the general curricula of different levels of education, be it primary, secondary, and even tertiary.
Dr. Masha, thank you so much. I don't know if our virtual speakers have any insights on these questions. Otherwise, I would love to wrap up this panel and thank our speakers for being with us today here in the room and those connected virtually. So thank you so much for all the good insights, for all the good dialogue. We would definitely continue elaborating and talking and bringing solutions and brainstorming, but I think we have to wrap up now today. So I'm very happy to invite Jean-Pierre Nyamazi for the concluding remarks.
Thank you so much. Again, I think we'll learn a lot, from the fund enabling making the laws to manufacturing vaccines. Really very diverse priorities and activities and results that came from this partnership. Something that we could all note is that countries are doing different things. And that's something we need to note on this funding and the nature of this funding. We really value the countries leading on these projects and making sure that the funding is going against what the countries see as the most priority activities, and they're really in the driving seat, which I think to me should be one of the criteria that really funding for AMR should really align to. Country ownership. And that goes to the question that Shadia was asking. How do you ensure sustainability of this? I'll give you an assurance because I've been part of the ministry. I've been a permanent secretary for the Ministry of Health in Rwanda for about 4 years. And we've received some external financing. What I could notice that when an external financing comes and serves as a catalytic that helps you to initiate something, if that fund stops at a certain point, you won't stop doing that thing. You'll find resources to continue. So that's what MPTF is all about, really being catalytic, bring the partners together at a country level, global level, regional level, start and really enforce that collaboration and tackle whatever is priority at the moment. And the countries for sure they will continue. So I think I have been...
Yeah, this one is... Yeah, come here.
I'll move quickly here to wrap up. So I was excited to continue speaking about that. I think the other thing we noted is, you know, the beauty of coming together. If this fund also contributed to something at this time around, it's all these quadripartite organizations working together. And I tell you, it's not always easy. Someone spoke about that yesterday, that multi-sectoral collaboration is not an easy thing to achieve. That's true. But let me tell you also something. Once you've been able to start and work together, it's like a happy marriage. You're always looking at your partner. When you go alone, you feel that you're missing somebody. So working together is doable, and when you dare to start to work together, I promise you, you'll always want to continue to work together. So which is something we've seen across the quadripartite organization, and which we could validate from what the countries have told us today. Again, thank you for people who have been able to come. I know there are competing priorities, competing events here in Brazil. Thanks to Brazil and member states of the G20 for offering this opportunity. Thanks to our resource partners. Huge thanks to our countries that really have been able to share the experience. And thanks you to Anthony for as well sharing your personal experience. Thank you so much, and we look forward to continued collaboration. Thank you.
Thank you, colleagues. And we wanted also to thank the colleagues who are behind the scenes from the quadripartite, all the technical teams who have been supporting and ensuring that this event is happening today in beautiful Brazil. So thank you again, and let's continue working together.